Welcome to Nutritional Medicine by Lab Analysis. I'm Dr. Cyrus Thomas. I've been a chiropractic physician, board certified for 35 years. I have a medical doctor of homeopathy from India, and I'm also a diplomat of the National Board of Homeopathic Examiners. We're going to be talking about the value of using modern day computerization to evaluate blood tests, hair analysis, stool, urine, saliva information received by laboratory analysis, and correlating or comparing all of those values and comparing them to the values of healthy people, mostly who are taking nutrients to stay well, and to bring us to a state of health by comparing our labs to theirs. Normally what's done is a person goes to the laboratory, their blood is taken, they're compared to the last 10,000 unhealthy people who went to the laboratory. The doctor looks at that and says, well, you're within normal values, you're okay, off you go. And yet people don't feel good. And they're wondering why, and it's because they're too close to the high or low ends of what really healthy really is. The values that the laboratory establishes are too great. Those values do not come from doctors. Those values come from laboratories. Let's take a close look at that. We're going to be using blood, urine, and hair analysis to diagnose for chronic illness. So, computerized lab analysis using blood, urine, and hair analysis to diagnose for chronic illness in order to feel good, to live long, to be pain-free, to be able to travel, to be able to enjoy many foods, to be able to go to museums and concerts and events, having relations, to enjoy the family, grandkids, to earn more and be able to save money, to avoid surgery, and for spiritual reasons, which I'll let you define yourself. All the reasons in which to stay healthy. Of course, if we can't feel good, we don't want to live long. And if we can't be pain-free, we don't want to live long. And if we don't feel good and we have pain and we can't travel and we can't enjoy foods because we've become hypersensitive, we can't go to museums, we're not having relations anymore, we probably don't want to live long. We're talking about having a good life so that and living long. I'll see if I can get this device to respond here and bring us to the next slide. I think I'll have to do it manually. Let's see. We've got a stuck computer here, and this has happened to me before. I don't know why. Maybe if we go backwards and then forwards again, we'll see. We'll try it again. There we go. Obstacles to cure. Eating too much breads, cakes, pies, cookies, not a good idea. Why? Too much carbohydrate. We bring the carbohydrates up too high, we end up producing a lot of insulin, we wear out the pancreas, we end up moving towards prediabetes and eventually diabetes. Too much alcohol, tobacco, marijuana slows us down, makes us apathetic. We're not so excited about living, we're not so excited about learning new things. If we take psychotropic drugs or pharmaceuticals to make ourselves feel better, eventually their side effects make us feel dull and dull-witted. Not a good idea. Too much sugar, too much ice cream, too many deep-fried foods. These deep-fried foods tend to harden our arteries. So it becomes more difficult to go upstairs, more difficult to do chores and play sports. If we do too much bad oil and we combine it with sugar and too much flour, we end up with diabetes and cancer. That is the formula for cancer. It is the formula of the American diet. And it is the formula for lab animals. What I mean by that is when laboratories want to do testing on animals that are sick, they want to test and see what herbs work, what nutrients work to get them better, what pharmaceuticals work. They use the standard American diet to make the animals in the laboratory sick. Bad oils plus sugar plus flour. They have known this, and the clinicians have known this for decades, and yet it's not being told to the American public. Well, I'm here to tell you. Difficulties in getting well. Some people need a 12-step program to overcome addictions. Some people need more self-discipline. It takes time to get used to eating right, to change the way you eat, to change your living habits. That takes time. That's normal that it would take time. Sadness and loneliness make it very difficult for us to feel motivated to take care of ourselves, to change our diet. Loss of purpose to living. When you have said to yourself, I've been here long enough, I've kind of had it, I'm tired, it's time for cancer to set in. It's time for the arteries to really harden up. It's time for you to transition. You need to have a purpose to live, to want to live. Financial depression. If our finances are too difficult, it's hard to be motivated to want to stay here. But it's a vicious cycle. You need to feel good, to think clearly, to be able to make enough money, to be able to feel good, to think clearly, to make enough money. Getting out of that loop is usually a snowball going down the hill. So we got to get back onto the good loop. What do? Oftentimes you need to get help from a psychologist or from a 12-step program. And you need to get healthy. You need to see a physician, somebody who practices like I do, who can truly get you healthy and not just load you up with a lot of pharmaceuticals that are going to have pages and pages of side effects. This is a report that we do for patients. We list all of the symptoms that they're having, and we cross-reference everything. Primary findings, suggestive of cardiovascular, liver. Here is interpreting all the test results, interpreting the lab, interpreting the hair analysis, diagnostic findings for coronary risk assessment. We're looking at this person's chance of having diabetes, how much inflammation, how much anemia, how much we've noted their hair amount of chromium, of arsenic, their hair calcium. We're looking at their hair mercury. We're going to look at a close-up of this in a minute. We also give dietary recommendations. We give exercise recommendations. These reports are very comprehensive. We've taken the blood, we've taken the urine, we've taken the hair, we've cross-referenced it, we've used a massive computer in Dayton, Ohio, and we produce this report. We're then looking at the blood test that comes from the report, previous tests, current tests. We're looking at the hair analysis, previous tests that they've done. We can retest a person over 1 to 3 years and compare everything and see what kind of progress they make over time. And let's see if I can get you the close-up of this here. This is one of the pages, the diagnostic findings of the coronary risk assessment. Their total cholesterol was 188. They had an LDL cholesterol of 87, a VLDL of 16, and an HDL of 63. Their coronary risk assessment was 2.98. It means they're probably protected against having a heart attack. We go into this in great depth in the report in paragraph form as well so that everybody can understand it. And everybody gets a copy of this report to take home and read as well. And we go over it with the patient, of course. Possible cardiac effect, the creatine kinase is a little high and the C-reactive protein is high. This is mildly elevated. CK, creatinine kinase, is commonly associated with breakdown of muscle, either cardiac or skeletal. It tells you the reasoning behind every test. Recent studies have shown that the C-reactive protein is one of the best markers for predicting the chances of a heart attack or stroke. A CRP close to 0 is desired. This finding is supported by In other words, this finding of there being a possible cardiac effect is supported by the high blood creatinine kinase, high blood SGPT, liver enzyme, high blood C-reactive protein, low blood hematocrit, okay, the amount of your blood's, the percent of your blood that is actually red blood cells. All of those together point to this. Now, it's wonderful to have a computer and the wisdom input into the computer by many doctors who do nutrition to come up with this. This finding is associated with the medications this patient was taking: Lipitor, Prilosec, naproxen, and Zetia. Those all combine to part of the possible cardiac effect in their side effects. Nutrients recommended: an inflavonoid called turmeric, of course the herb that's used in Indian cooking quite a lot, can correct these values. This person doesn't have to buy a bottle of vitamins. They need an herb, okay, for this finding. Now, we suspect inflammation of the liver. This finding is supported by all of these findings in the blood test: high blood globulin, high blood erythrocyte sedimentation rate. This finding is associated with the medications they're taking called diflucan, Lipitor, Prilosec, and naproxen. They're recommending silymarin, milk thistle, and vitamin C. Now, after we look at all of these findings and put it all together, we are essentially coming up with a... This is me in my office, by the way, doing an exam on a friend of mine. We use x-rays whenever patients have them to help us diagnose what's going on. We listen to the heart, we look in the eyes, we look in the ears, we take the blood pressure. All of that is common. But what I was saying was that when you get a computerized analysis, you're getting compared with many other people. That's the difference. Medicine up to now has been practiced whereby you go to the doctor's office, the blood tests are done, you come back, the doctor looks at the tests, he says, here's what you need to do, take this drug, take that drug, otherwise everything's fine, and off you go. It's done in very short order. We're not doing that. We're taking your hair analysis, blood analysis, urine analysis, sending it away, getting a 15-page report, looking at it very comprehensively and saying, if you really want to get well, not just make these symptoms go away or make the numbers come out better, then here's what you need to do. We recommend vitamins, amino acids, herbs, and enzymes. This is what an average British child eats in a year. Most of it's all junk food. I don't know how he'll be able to live a long and fruitful life. The average American eats a little better. There's good meats and dairy products over here. There's a number of processed foods over here. Not good. So the American syndrome of diabesity, which we're seeing a lot now in about a third of the population, is due to too much soda, too much ice cream, too much corn syrup, high fructose corn syrup, too much white flour, too much bad oil. What are bad oils? Usually the liquid oils, all of them except for olive oil. The good oils are canola oil and butter, which are solid at room temperature, but not solid in your body, so don't let that bother you. And olive oil, which probably is best not to cook with, it's best to use on salads and keep it cool. The American diet has a lot of imbalance in it. I could do a whole show on just this one slide alone. Essentially, we need to change the way we do grains. We eat far too many grains. We eat far too many legumes. I do another show on that, the lectins, the prolamines, the opioids that are in those products. Not good for us. So we'll cover that in another show. What is a nutraceutical? A nutraceutical is essentially a nutrient used as a medicine. Instead of a pharmaceutical, which is a man-made drug that gets patented, and the price is high for a while, and then eventually the price comes down. Instead of doing it that way, we use molecules that already exist in nature and use them as medicines, nutraceuticals. Somehow we've all become fooled to think that man-made molecules are better than natural molecules, and it's just not that way. In the last 30 years, they've shown an explosion in nutritional knowledge. Nutraceuticals are medicines, they are complex molecules. One of the problems, of course, is that everybody thinks that they're a nutritionist and that they can do their own nutrition and that they can just go in the health food store and ask somebody what they should buy. It's much more complicated than that. In fact, it is as complicated as medicine itself. Don't stop your medications unless you make changes. You have to make changes. You have to be doing something that's making you healthier before you can stop taking the man-made molecules that are keeping you going for a little while. They're not curing you, they're just sort of keeping you going. Of interest, genes load the gun, the environment pulls the trigger. You're sort of born with a genetic gun that's loaded, and then your environment, your parents, your school, your air, your water, your food, pulls the trigger. So if you have a gene that's going to make it difficult for you to have a good pancreas, a good liver, and then you have a lousy environment, well, that'll pull the trigger and you'll have problems with your liver, your spleen, pancreas. High fructose from fruit or from high fructose corn syrup can cause a high blood uric acid, which is gout, and this makes liver enzymes go up. In this case, milk thistle is not indicated. So all of you who are taking milk thistle because you think it's good for your livers, your liver enzymes are high, and the reason your liver enzymes are high is because you have too much fruit in your diet or too much high fructose corn syrup from processed foods in your diet. You need to reverse all that and stop taking the milk thistle. That's sort of a little tidbit in nutrition that most people don't know. Of interest, since fat cells store toxins, it makes sense to detoxify before losing weight. Otherwise, the loss of weight will release toxins into the blood and the patient will not feel good and get discouraged. Makes sense. When fibrosis of the liver affects the blood flow, you have cirrhosis. When cirrhosis affects other organs, you have ascites, which is this enlarging of the abdomen. Of interest, why do pharmaceutical prescribing doctors tell patients with lupus to be ready for a liver or kidney transplant in 10 years? Well, they think it's because they have lupus. Maybe it's because the pharmaceuticals that they'll take for 10 years will ruin their organs. Case, a 52-year-old woman. She had a high cholesterol of 621, a high triglycerides of 766. She had irritable bowel syndrome, tension headaches, gained 50 pounds in the last 3 years, had 4 biopsies on both breasts, which were benign, sinus and ear infections. She gets hives frequently. Within 2 months on the program, a nutritional program, her cholesterol had improved from 621 down to 198 in just 2 months. Triglycerides went from 766 down to 199. She feels much better. Everything has been greatly improved. Thyroid is back to functioning normally. Weight loss, 20 pounds. Is off all her prescription drugs. She gets hot flashes. She had hot flashes, but they're much improved. Instead of saying my body isn't working right, I need to add some drugs to make it work right, the doctor will know what to do. Say instead, my body isn't working right, and instead of taking a drug that will have 30 side effects, I need to return my body to the state it was in before my symptoms began, but by supporting it with natural products. Get the body healthy and it will cleanse itself well. When we do a blood test, we do 52 items. This fellow had a number of code blues, which are a big problem. The reds are high warning. The yellows mean we need to pay attention to them. After 5 months, we did a repeat study, and the blues were gone and only one red remained, making progress. This is a nice way to color code how well we're doing over time. We're looking at triglycerides, iron, thyroid studies, white blood cells, red blood cells, kidney functions, electrolytes. Over the years, test descriptions, test values have been changing. They've been allowing lousier and lousier readings to be called normal. We've taken it the opposite way and narrowed it and said, no, you need to be even better than what we're finding. Hemoglobin A1C, it's an indicator of how much sugar your red blood cells have been storing over the last 3 months. It tells us if you're moving towards diabetes. The old range used to be 3.4 to 6.1. That has been changed, raised to 8.0. That means we're allowing people to have much higher values and be called normal than we did before. It makes our national health look better, but it's not true. Our national health is really worse. It's been done for uric acid, sodium, magnesium, calcium, serum, iron. The range has gone lower, where we're allowing people now with as low as 35 to be okay, whereas before it had to be at least 50. Cholesterols from 140 to 200, 100 to 199. In other words, we are now saying it can get as low as 100. When cholesterol gets too low, you lose your defense mechanism in the body. This is a very bad change for our country. Triglycerides, low-density lipoprotein cholesterol, VLDL, thyroid hormones, white blood count, they've all been allowed to go in directions that we as nutritionists do not approve of. So, the laboratory says you're okay if you're between the dotted lines, anywhere in here. We say you're okay if you're in the blue. If you go to your doctor and you're in the flesh-colored area, whatever color that is, you're told you're okay, but in reality you don't feel good. In these lab tests you will see lab findings that a doctor will say are normal, but they are not. You don't feel well. Something needs to be done. Many more tests are ordered by regular doctors, including many more tests are ordered by us than by regular doctors, including cancer markers. We do cancer markers before we see a tumor has formed. And a regular medical profession likes to find a tumor first through an MRI or a CAT scan, or through touching, through palpation, or through regular flat x-rays. And then they do cancer markers, tests from the blood. We do cancer markers beforehand. We look if you're setting up a trend to move towards the production of tumors in your body. Our ranges for normal are more stringent. A healthy range is created. We showed you that. Lab results are compared with those of other patients and also with the results that the nutrients prescribed for them were able to obtain. So if we give a certain regimen of nutrients for a lab values that are not correct, we need to test how well those nutrients worked in correcting those values. So those nutrients have to become famous or unfamous over time for dealing with those conditions. There's a testing mechanism here. It's not just take this drug, if you don't feel well, come back, we'll add another one to it. It's actually good medicine. It's actually good science that we're doing here. Follow-up studies are compared of the same patient, sometimes every 2 months, sometimes every 6 months, sometimes once a year if a person just wants to fine-tune. And then the results are clearly seen and marked and compared. The advantages to computerized lab evaluation are all of those things. What is nutrition? Essentially, molecules come together, they attach to an enzyme. The enzyme changes them from green to these colors, and off they go, they've been changed. Molecules are always having to be changed. Enzymes help us do that. Examples of enzymes are vitamins, minerals, amino acids. Bad things that get in the way of this process of changing molecules with natural substances are heavy metals and free radicals. There's many different branches of medicine. In the structural category, we have chiropractic, massage, body techniques, physical therapy, exercise. In the molecular area, we have food, nutraceuticals, herbology, and drugs, which is pharmacology. They're all chemicals. They go to the mouth, into the intestines, and then to the blood, and then into the cells. And they all go into the cells and affect the chemistry there. There are many things I wanted to talk about in that area today, but we are running out of time. So, we'll move on here. Most trends are asymptomatic. Prevention is the key. The masking of symptoms through pain can make us think we're doing better than we are. I can certainly move a lot faster than this show can. This is my office in town here. Integrative Alternative Medicines with an S.info is the website. I want to thank the Community Media Center of Marin for making this show possible, especially Vita Flores for being our director. And my name and number, my website. The website is fun. It'll also show you how to get to a YouTube website so you can see 30, 40 of these shows. And we've been doing these for a long time. They air every Tuesday night at 8 o'clock. And so I hope you enjoy the information that I bring to you. I'll keep bringing you more information. We shoot 2 new shows a month. And thanks for watching, and may you be in good health.